More colleges and medical institutions are requiring masks or vaccines now. Joining us to talk more about the increasing number of vaccine mandates and mask requirements is internal medicine specialist Dr. Abha. Dr. Abha, thank you so much for joining us as always.
Ruta, thank you for having me. Good morning.
Good morning. So let's talk about these requirements to mask up or get vaccinated. More and more institutions are implementing these mandates, and this shouldn't come as a surprise, especially now that the FDA has fully approved Pfizer, correct?
That would be correct. Thank you for the question, Ruta. Over 700 colleges and universities around the United States is mandating vaccines and or exemptions that are within the confines of the rules, or weekly or twice weekly testing to be done, sometimes at the expense of the students. So the understanding is this: last year when colleges and universities went remote, billions of dollars are lost in terms of revenue to universities. And unfortunately, with the COVID infection, portions of the university's face shutdown. Same go for companies. Now that we have full FDA approval of the Pfizer vaccine, many of these colleges, universities, businesses are feeling more comfortable issuing mandates. And that would include Spectrum Health here in West Michigan and Henry Ford on the east side of the state. Houston Methodist was the first hospital system here in America to issue that mandate months ago, with the understanding that in order to keep our patients safe and our personnel safe, vaccines are really imperative.
Now, let's talk about the possibility of booster doses. Explain to us why a third dose of either Pfizer or Moderna could be helpful, or even a second one from Johnson & Johnson.
We're very fortunate in that Israel has been producing a great deal of data, being the first country in the world to have achieved over 60% vaccination status by May. So as you can well imagine, they've aggregated data, as have we here in the United States. And it would seem that there may be waning immunity over time after 6 months or so. So those who received the Pfizer and Moderna vaccinations back in December and January, the phase 1 and phase 2A rollout, to include healthcare workers, first responders, and our elders in nursing homes, they would be eligible for a booster dose. Now, I want to speak of semantics. Booster and third dose are actually the same amount of the inoculation or vaccination. They're different terms that apply to different sets of people. If you are immunocompromised, having received a transplant, or are enduring cancer therapy, have severe forms of HIV, I would ask you please to talk to your doctor to determine if and when you should obtain your third dose. In terms of boosters, please talk to us in healthcare. We will be happy to shepherd you through that. I know that for healthcare workers, that rollout is expected sometime in September.